Hello, everybody, and welcome. I'm Susanna DeBaca, the President and CEO of Business Publications Corporation, which is the parent company of DSM, your host today. And I'm very pleased to welcome you to our Lifting the Veil event. I'm joined today by our co host, Andrew Allen, who is the CEO of YSS. Welcome, Andrew.
Hello, Susanna. Andrew Allen, great to be here with my peer group representing behavioral health and co-hosting with you.
Well, I'm very, very glad that you're here. I'm going to introduce Andrew a little bit more in a few minutes. But first, let's talk about why we're here today. As many of you know, DSM Magazine has, for a long time, been committed to shining a light on mental health through our Lifting the Veil publication. And during the pandemic, we created a virtual series which was so well received that we've decided to continue it. This year, our theme for the series is The Road to Recovery. Through two different virtual events and an annual publication, we're going to explore how the lives of Iowans have been indelibly changed by the pandemic and the ensuing disruption in what some people are calling America's mental health crisis. This series is also going to shine a light on hope and resources for those in recovery from mental and behavioral health challenges. We encourage you to ask questions in the chat. This is really your event. So if you want to start by simply chatting a question that you have for today, we'd love that. Or if you'd like to share why you chose to join this event, we also would welcome that information in the chat. While you're doing that, before we start, I would like to thank the DSM team led by our fearless editor-in-chief, Christine Riccelli. This entire team works tirelessly to create and execute this series along with the magazine. Every year, they create the annual Lifting the Veil publication. If you have not seen this magazine that we unveiled at the end of last year, you can see the online version at the address listed here, or you can order a hard copy by calling 515-288-4582. And you can actually stop by our office as well at the depot downtown if you're interested in picking up a copy. I also want to thank our sponsors who've made this program possible. Our presenting sponsor is Clive Behavioral Health. Our supporting sponsor is Delta Dental, Easter Seals, Employee and Family Resources, and IMT Insurance. Our sustaining sponsors are Capital Crossroads, Mid-Iowa Health Foundation, NCMEC, and Optimate Behavioral Health Services. We're grateful to all of them, not just for their sponsorship, but for their commitment to mental health as well. Special thanks go to presenting sponsor, and I would love to welcome now Jason Bridey, who is the Director of Business Development at Clive Behavioral Health. Jason, welcome.
Great. Well, thank you, Susanna. And I want to thank you all for joining us today. At Clive Behavioral Health, we're honored to be a presenting sponsor of the Lifting the Veil educational series. This Lifting the Veil webinar series and the publication helps to shed light on the mental health needs of our community. This program brings timely mental health topics to the forefront, offering expert providers like our panelists today. It offers these expert providers to provide insight into the complexities of mental health. You know, mental health affects all of us. The effects can be devastating for individuals who suffer. It impacts families, friends, our schools, the workplace, social services agencies, law enforcement, and the healthcare system itself. Here at Clive Behavioral Health, we cherish the role we play as a new provider in our community, providing pediatric and adult inpatient, acute, and outpatient mental health care. We appreciate the opportunity to be a part of this special presentation today. And so with that, I thank all of you for tuning in. Thank you.
All right. Thanks, Jason. Susanna, you ready for this?
Absolutely ready. You want to
Today,
tell us a little bit about how the program is going to work?
yeah, you bet. Today we're going to be focusing on youth in recovery. So we've got a number of mental health experts, and Susanna and I will be asking them questions. And as Susanna mentioned, we're going to be monitoring the chat. So if you've got questions or comments, and I see some coming through already, go ahead and type them in, and we'll see if we can integrate them along the way.
I'm excited to look at the chat. It looks like we've got people not just here from Central Iowa, but somebody tuning in from Arizona. We've got parents who have teens in recovery. My heart goes out to you, and I hope that we can provide you some hope as well as some resources today. It looks like there's people from the behavioral health industry as well. So thank you for everything that you do to assist with this mental health crisis and our kids in need. Before we introduce our experts, let me tell you a little bit more about Andrew and about YSS. YSS is a leading Iowa nonprofit that serves youth through counseling, treatment, housing, and shelter, prevention programs, life skills, and other services. And I have full disclosure. I've told Andrew before, when I was 18 years old, working at YSS was my first job out of high school in prevention education. And so it has a very dear place in my heart for the work that the organization has done in Central Iowa for decades. Andrew is recognized as a leader in behavioral health. He was selected to be the president and CEO of YSS in 2015. He has a long history with the organization that he'll probably tell you about, having been through YSS programs as a youth himself. He's recognized as a leader nationally and also in the state. Thank you, Andrew. We're just delighted that you can be here co-hosting.
Thanks, Susanna, for asking. Sure appreciate everything that DSM Magazine does to shed light on the issues of behavioral health, especially as it relates to kids, something near and dear to my heart, as I was, as you mentioned, helped as a kid, but also now that's my vocation. So love that you got your start at YSS, and really excited to introduce our expert guests. So first, we'll just kick off. We're joined by Dr. Sasha Khosravi, pediatric psychiatrist and chief medical officer at Clyde Behavioral Health. Dr. Khosravi received his medical degree from Des Moines University College of Osteopathic Medicine and has been in practice for more than 20 years. He's been a guest on a number of Lifting the Veil programs. Welcome back, Dr. Khosravi.
Thank you very much. Honored to be here.
Our next expert is Amber Rand, Vice President, Orchard Place Campus, which provides mental health treatment expertise for Iowa's kids through inpatient, outpatient, and community-based programs. Amber oversees Orchard Place's residential treatment program, which is a highly respected intensive psychiatric residential treatment center. Greetings, Amber.
Hello, thank you so much for having me today.
Next up is Pat Rognes, Vice President of Behavioral Health Services at Children and Families of Iowa, which, if you can believe it, since 1888, I knew I would do that, has been dedicated to improving the lives of children and families throughout the state of Iowa. They serve Iowans through important program areas like domestic violence, prevention and intervention, teen programs, family support, early childhood development, mental health, and substance use disorder treatment. You may have seen that CEO Janice Lane Schroeder of Children and Families of Iowa was slated to join us today, but due to a conflict, Pat will be our expert today, and we're delighted to have her. Greetings, Pat.
Thank you. Thanks for having me, Andrew.
Our final expert is Dr. Terry Wallig, CEO of ChildServe, which improves the health and well-being of nearly 5,200 children each year throughout specialized clinical, home, and community-based programs and services. Dr. Wallig joined ChildServe in 2011 as Vice President and Medical Director and began serving as CEO in July 2018. Greetings, Dr. Wallig.
Thank you, Andrew. Wonderful to be with you.
Well, we've got a great group of experts here today. Thanks everyone for joining us. And let's get started with our panel questions. Susanna.
We want to start out with the same question for each of you, just to sort of level set on the landscape. So what I'd love for each of you to do is just share information or data on the severity or increase in mental health problems in youth, especially right here in Iowa. And what factors are increasing are influencing this increase? Dr. Khosravi, let's start with you.
Thank you very much. Again, honored to be here, and I appreciate DSM Magazine carrying the conversation for mental health. There's been a lot of studies across the globally, actually, the UK, Canada, United States, and all of them really reflect the same thing, which is rates of major depressive disorder, rates of anxiety, rates of suicide attempts are increasing across the board. Now, there are several factors going into that. Obviously, social isolation is a major factor in that. But you also have to look at other things. Rates of emotional abuse were up 55% in the study that the CDC did. 11% suffered from physical abuse. A lot of these kids are suffering from a parent losing their job. That was up to 30%. And in the study that they did looking at high school students, 44% of those felt some sort of hopelessness or depressive kind of feel to that. So that's really high. And if you look at our rates of emergency room visits, that's been escalating more than 30%, and greater than 50% of those are related to suicide attempts. So those are really significant numbers. There's also a grief bereavement factor. 140,000 children have experienced the death of a parent or a grandparent during the pandemic. I don't have specific data for Iowa trends, but I can tell you clinically, being in the trenches, the number of emergency room visits have been escalating. We have a lot more kids boarding, waiting in emergency rooms, sometimes for days, sometimes for weeks even, waiting for a bed to open up across the state. And then when we have someone on our unit and we discharge them, the wait time for them to get into a psychiatrist or a therapist, I've noticed the pattern over the last year or two has been progressively increasing.
Well, mental health crisis is right then, based on the things that you're talking about. Amber, tell us a little bit about what you're seeing. Why is this increase happening, and how bad is it?
Yeah, Dr. Khosravi gave some excellent statistics. For us here at Orchard Place, we've been seeing a large increase in referrals across all of our programs, both outpatient and residential. In particular, we're on par this year to have received more than 800 referrals, which is about over 100 more than what we got in the year prior. And in the year prior to that, we also increased it by over 100. So that's 200 more youth referred to our program in the last 2 years, which is quite an astronomical number. What we really see happening for kids is that the pandemic obviously has disrupted routines and schedules. It's kept kids away from in-person schooling for such a long period of time and been isolated at home. We've seen a lot of youth that were doing fairly well at home prior to the pandemic. They were managing their mental health and things were moving along fairly smoothly, but due to this disruption, things started kind of falling off the rails, and we saw more kids in crisis at that point. Families also are under tremendous strain, whether they're concerned about their own health or health of relatives due to the COVID disease. But in addition, obviously, the economic impact has been tremendous. Many families feeling that through job losses. And as well now, with the inflation rate being so high, that's another stressor. And so when families are stressed and under strain, we really see that also impacting the kids as well. And so I see that being a huge contributor over these last 2.5 years or so during the pandemic has been that social isolation, as well as the economic strain within the families themselves is impacting youth mental health.
Yeah, very interesting, Amber. And the fact you're saying that now the economic environment is even creating more strain is a concern. Pat, what are you seeing? Why is this happening? Why is it so severe?
Well, so this has already been touched on, but I think about the suicide data, and that is such a significant indicator, I believe, in regards to untreated mental health, right? So in 2018, suicide for ages 10 to 24 was the leading cause of death, and it continues to be so today. In 2019, also, the National Health Organization, Health Foundation, put out data that showed that 1 in 5 high school students seriously considered suicide. To me, as a community member, as a grandparent, and as a provider, that is so sad and so scary that so many of our youth are suffering. And the same foundation also puts out Iowa data that shows that Iowa's suicide rate is higher than the national average and has continued to be so since 2012. So pre-pandemic, we were already in a difficult spot, and now we're in an even more difficult spot. And everybody already talked about reasons for that. I think one piece that always concerns me is just the increased violence in our nation and in our community. And what we know about mental health or PTSD is you don't really have to be a part of that to have it affect you. You only have to be witness to it, right? And so our kids now are so much more connected to social media and they're witnessing that all the time. So that's really scary. I think the other piece for me is just always keeping in mind the impact of marginalized communities, because we know that the Native American community and the LGBTQ plus community, that suicide data is even higher. So yes, Amber spoke to it and Dr. Karosky spoke to a lot of different reasons that it's increasing, and it is increasing.
Well, Pat, I'm really glad that you brought up the LGBTQ plus community too. I saw someone in the chat said that's the population that they're specifically working with, and with a lot of legislation sending messages to those youth. I think we're seeing mental health effects there. Dr. Wallig, tell us what you're seeing. Is there data or information that indicates what's contributing to the increase?
Yeah, thank you, Susanna. Mostly like what everyone else has said, the data are confirmed at Child Service as well. We continue to see an increased number and severity of need for children who require mental health and psychology services. Specifically, as others mentioned, there's just a new level of anxiety in the children we serve. There was a trend before the pandemic. It's only been heightened throughout the pandemic, and likely caused by many of the reasons others have mentioned. And I would echo what Pat said about the violence and issues around safety in our community. You know, children are a product of our environment. They absorb what we absorb, and they sometimes have far less developed coping mechanisms and ability to express their needs. At ChildServe, we serve children with a dual diagnosis, children with intellectual and developmental disabilities, with co-occurring mental health, behavioral health challenges. That's a unique combination. And any child with developmental or medical complexities may likely have not been getting some of their routine care during the pandemic, along with all the other social isolation and educational challenges. So again, they're impacted coming out of the pandemic. So compounded with all of that is a decrease in number of providers and Medicaid providers, staffing shortages. So it just compounds the issue.
I think that's a great segue into just talking about, you know, we hear regularly about the lack of access to treatment, too few beds in the state, you know, hospital settings that are overflowing with need. And we've obviously got a number of providers on the panel, people who are doing this work and providing services. But I wonder if we might have you know, a quick conversation about what resources are available and really where parents can start. Dr. Khosravi, could you touch on that?
First, I think just looking at this panel, and the folks here obviously are passionate about mental health and their organization. So I've had personal experience with all the organizations represented here: YSS, CFI, Orchard Place, and ChildServe obviously have tremendous, you know, improving access for a lot of our patients. So, and I think at the end, we're going to give you a list of organizations, Easter Seals included, for crisis stabilization as well. The Center for Disease Control and Prevention actually has a parental resource kit, which is really cool. So if you go to cdc.gov and look up parental resource kits, it's a really cool, innovative, updated, really ways you can approach your children, talk about mental health issues, resources available. But locally here, Mindspring National Alliance, we've had a lot of success with them really providing a lot of our patients resources. You make the phone call to them and they will give you a lot of resources as well. So that's been a really good thing for our patients. Now, hospital-wise, you kind of touched on it. There's a massive need for beds. I'm proud to represent Clive Behavioral Health. One of our missions is obviously to expand our bed capacity for the pediatric population. And really in the next 3 to 4 months, I believe we will be kind of the leading hospital in terms of bed capacity for our state across all the ages. So we're real excited about that to improve that capacity. All the other organizations within town, Broadlawns and Unity Point, also have really some great strengths with providing urgent care. So sometimes your kid may not need an acute hospitalization, but more of an urgent care type setting where they need a med adjustment quickly or someone just to evaluate them. So there are those resources as well. Now, the other point I want to bring up that I thought about is that the stigma of mental health, right? No one has a problem asking about who your good surgeon is or who a good pediatrician is. Use the community, use your friends. There's lots of mental health issues across your community, but it's sometimes a stigma just to ask who a good psychiatrist is or who a good therapist is. So I would challenge you that to really open up that conversation and destigmatize mental health by reaching out to your community and really asking what resources they're utilizing as well. So I think that's an underutilized aspect of resources that we should be doing and, continue this conversation to destigmatize mental health.
Yeah, I think it's great. Oftentimes in private conversations behind the scenes, you start talking about mental health, and of course, everybody's got a connection, and everybody's talking about, the services that they're pursuing as well.
So we've established that this is a really significant crisis. We've established that there's a lack of beds, but there are resources available. I think one of the things we want to talk about today in particular is hope, that just because you are experiencing a mental health crisis or a child in your family are experiencing that, this is something that that you can work through. So I'm really actually interested in hearing what are some recovery success stories that you've seen. Now I know recovery means different things to different people depending on the underlying issues, but let's just start with some hopeful stories, and then we can drill more into how did they get there, how can you get there if you're a parent or if you're even a teen watching this program. And we'll just continue with you, Dr. Khosravi, and then I'll ask that question of everyone. So success stories.
Well, I work in the trenches, the inpatient unit. So inpatient implies, kids who are suffering from the most extreme symptoms, suicidality, aggression, psychosis, mania, etc. And I can tell you when these kids walk in through our doors, they feel like no one can understand them. They have a sense of hopelessness, and really everything is dark around them. Their thinking is dark, their future is dark, and they just sort of feel hopeless, like I mentioned. So one of the really cool things about inpatient hospitalization sometimes is, obviously you're working with mental health professionals that are caring and compassionate, and there's no stigma involved. But there's also this sense of community. They get together with these other children who are going through the same path, struggling with their own mental health issues. And all of a sudden, they kind of realize that they're not alone. And they see other kids who are fighting through, they're showing resiliency, they're getting better. So that sense of hopefulness that is provided when you know that it's, you're not the only one suffering from this is really a really neat thing that's kind of unintended. It just organically happens on our units. And if you look at our patient satisfaction data, one of the greatest things that I'm proud of is when our patients walk out these doors, they're generally feeling a lot better than they came in. And I think part of that is just a sense of hopefulness that we can provide during the hospitalization. Also, looking at their peers and their fight through their mental health challenges.
Mm-hmm. Thank you. Amber, put a little bit more of a face to this for us. What are some success stories that you've been seeing on your campus? What's been working, and where's the hope?
So to echo really what Dr. Khosravi just talked about, I do think youth come to our setting and feel a level of acceptance that they have not felt elsewhere. And I'm going to share a story that we just got in a lovely email a couple of weeks ago. This was a young man we had served in 2018. So 4 years later, we're hearing from this individual. He was 15 then, struggling with depression, just defiance, anger, stealing, some substance use issues, and also had gender identity issues. And when he came to our campus, it was one of the first times as a transgender youth, he really felt accepted. He was from a small town in Iowa. And I just think he was able to do the work here on his other core issues and had that level of acceptance. And his parents did a lot of wonderful work here as well. We just got an email personally from him with a picture of him, high school diploma in hand. He's doing the thumbs up. And he just said, I made it. I graduated high school. You know, I went from being a C student to an A and B student, has plans to attend college, wants to go into human services and work at an organization similar to Orchard Place or others to help give back to kids like himself. And I just think when we hear those stories, even 4 years later, it's so powerful. And it's powerful to see that recovery is possible. Families and youth can find hope and can achieve lifetime goals if they do the work that's necessary. So I just love sharing that story with you all.
For even 4 years later, but especially 4 years later, right? That long-term recovery is possible. That's a great, very encouraging story.
Yeah.
Yeah, thank you. Thanks for sharing that. I think sometimes when we talk about mental health youth, we're just thinking about this group. These are real people, these are our neighbors, these are our children. And to know that there are people who are coming through this and out of this is very gratifying. Pat, you are also on the front lines. What are some success stories or factors in success that you're seeing?
Well, yes, thanks for that question. At CFI, at this, we do outpatient mental health and substance use services. So when I asked the clinicians that work there, tell me some success stories on an outpatient level, there was so many. But the themes that I got were really being able to reduce that emotional reactivity between parents and the youth, which is normal through adolescence, but when there's a mental health crisis, it's even more so. Youth that are feeling just more connected. I think Dr. Khosravi mentioned this before, find the clinician that works, because if you can develop a trusting relationship with youth, and then that youth allows you to bring the parents and or the caregiver into session, that can really set families up for success. But I do want to say that I think a success story for everybody on the screen and everybody that's listening is, we had a mom call in the other day that said, and I quote, "My child asked me to find them a counselor that they could talk to, and that's what I'm doing." So on two levels, all the work that's being done in regards to trying to destigmatize mental health, that's having an impact. And the other piece is youth are advocating for themselves. So to me, that's a success story too.
That's fantastic. Thank you. Thank you for sharing that. Just a sentence really speaks 1,000 words. So, and I'm glad that you're a trusted place that they can call. Dr. Wallach, what about you? What are some success stories you're seeing at ChildServe?
I think one of the messages here is that there are so many successes, and we can lose hope if we don't remember that. But we had a young baby admitted to the pediatric rehabilitation unit at ChildServe several years ago due to very complex medical conditions. In fact, her medical condition was so severe, it wasn't even sure that she would survive pregnancy and birth. But she did, so came to the pediatric rehabilitation unit for some medical care and rehabilitation. She also had a very complex family and social situation, and in fact, ended up in the foster care system. So because of all this complexity, she stayed as an inpatient at ChildServe for several years. The good news is she was making steady progress with all of her physical challenges, but along the way developed some behavioral and mental health challenges as well. So also began receiving mental health therapy at ChildServe. It was interesting to watch her progress. Through that therapy, she was able to better identify her needs, understand her emotions, and even communicate for herself, advocate for what she needed to her caregivers. And that really helped launch her trajectory forward. I was happy to hear from the team members that she now has been successfully adopted into a loving home, and her future looks very, very bright.
Great.
That's excellent. And Andrew, I'm just going to put you on the spot since you guys are doing the same thing. What are some success stories you're seeing?
You know, I was thinking, thanks very much. I really appreciate the opportunity. Love success stories. It's what keeps us going. This is not easy work. And you've got to, really relish in those letters that you get, 4 years later, and the anecdotes of success. Most of the folks on the panel, aside from me, probably they've got names in front of or letters in front of their name, or letters after their name. But I think everybody on the call, whether you're in the field as a professional, or you just care about your community, and especially kids that might be in need, can play a role. I was a recipient of services from YSS when I was a kid. Now I get to lead the organization that I credit with saving my life. And one of the things that meant a lot to me was the founder of YSS, George Blitzos, came to my graduation. And I don't know that I knew him through my treatment journey, but he gave me some encouraging words. So I do the same thing with all of the kids that graduate our adolescent addiction treatment program. I actually take them to breakfast or lunch. Generally, it's, a small group, but this Monday, I took a young man to the Grove Cafe on Main Street at 6:30 in the morning, and we got one of those giant pancakes. And I invited a friend who happens to be the CEO. He's my age, but CEO of a business in town, and he cares a lot about YSS. And I got permission from the young man. And he just, he asked some questions over breakfast, but he just encouraged him in a way that he wasn't being paid. He had genuine interest. And I know that he walked out of breakfast standing a little straighter and more confident. And I think that so many of the kids that we're serving, I mean, you've got some residential providers represented here, inpatient hospitals and residential, where kids come to us to be served. But guess what? Most of these kids go back home. So when they go back home, they need an encouraging word. They need a connection. John, my friend, actually followed up with an email later that day. He said, "Hey, he's going home to Marshalltown. Is he looking for a job?" And I said, "I don't know, probably." And he connected this young man with the CEO of a business in Marshalltown that's hiring. And so my hope is, right, that every young person that leaves our program, is successful, but we've really got to do everything we can as a community to, wrap them around with services and support, because we can only do so much, and it does take a community. All right, so back to me, maybe. Let's get back to the me for questions, the panel for answers. I think this is it's personal for me. I'm now in the field. I love this as a vocation. But and I oftentimes refer to myself as a person in long-term recovery. I'm keenly aware that this is a family issue, and I think my mom, who's in visiting from Colorado, might be on. Let's talk about how it feels for parents of youth who are in crisis. They're impacted in a way that different than a disease like cancer, I believe. So Amber, do you want to talk about what it feels like for parents?
Yeah, I'd be happy to. So a lot of our parents, by the time they've typically reached residential, they've been through a lot in the home, in the community, at school with their child. And many of them feel just very overwhelmed, a sense of helplessness and hopelessness at times. Really feeling scared also is something that we hear a lot from our families. Just constant states of worry and sleepless nights are impacting them, as well as often the whole family. We hear quite often about the entire family essentially being under siege at times because of how a youth's emotional instability is impacting everyone who lives in the household. The other part that I think is particularly hard, that's different than, for example, a child with cancer, is just the stigma. And so parents and caregivers really feel like, they can't talk about their issues. No one understands their issues. They don't know who to ask for help. Really feeling alone at times, and as if no one can understand what it's like living in their home environment. And often they're jumping from crisis to crisis and feeling very physically and as well as emotionally exhausted and fatigued by the time they typically arrive at our doors. And so sometimes just having the youth come to even a short placement like a hospital or a longer term placement like a residential center can give families just that moment to take a breath, kind of get themselves regrouped, and then hopefully they will be then able and willing to participate in the therapies and the programming that the whole family needs in order to heal from the illness or disease that's actually impacting their child.
That's great. Dr. Walid, what do you see?
I talk with some of our frontline team members, and they share that they hear from families that they feel frustrated, powerless, desperate. Certainly words that are very difficult but necessary to hear. It can be very isolating for parents in this situation. They run up against a lot of brick walls if they're trying to access services. So I think our journey as providers, but also community members, is to consider reaching out, connecting. As the social stigma decreases, let's build stronger connections with families, many of whom are struggling.
Yeah, I think all of us, most of us have kids of our own. We've had good questions on our own. I work with professionals in the field who come to me regularly and say, man, I can't imagine not knowing what I know and being able to get access to help. So the desperation and hopelessness is a big deal. I'm encouraged, the 988, I think maybe that's going to come up later, but 988 is coming, right? So this call line that parents and individuals who are desperate, who have a mental health need, can call, I think, starting in July. So let's talk about maybe youth themselves. And I think maybe in a future panel, we'll have parents and youth on a call. I think that's one of the things that is important to get their voices recognized. Susanna and I both encouraging comments in the chat, but what do we feel like, what do we sense it feels like to be a young person who is desperate and hopeless and in need of services? Dr. Khosravi?
Yeah, this is something we face daily, and I admire the courageousness of these kids trying to build up resiliency to fight their mental health battles. So it's, I learn more from them sometimes than I provide to them on a daily basis, I would say. But like you mentioned, that sense of hopelessness and that sense of nobody can relate to you is really a key thing with these kiddos. They just don't feel like anyone can walk in their shoes. So that was kind of what I touched on earlier. But I would say what happens with these children, there's really 2 or 3 things I look at. One is they just lose interest in things. Nothing gives them joy anymore. So everything becomes really mechanical in their operation. And that's really a massive struggle. And then obviously one thing, in kids, depression, anxiety presents differently than adults. A lot of these kids become a little bit more irritable, poor emotional regulation, and they start actually acting out and having disruptive behaviors. And one of my biggest teaching points to my medical students and residents is do not label these kids immediately. These are external behaviors of what they're suffering inside. So a lot of these kids get written off because they're conduct disorder, they're bad kids, they're on their way to sociopathy, where in reality, it's the internal stuff driving the anxiety and depression. So really need to stop labeling and understanding why they're acting out. Not to say there's not maybe some children who just purely act out without that mental health component, but honestly, I haven't seen many of those. So that is one key thing, the irritability, the disruptive behavior. So if there's a sudden change in your kid with that, don't just write it off to normal adolescence. If it's a drastic change, there could be some serious underlying mental health issues that need to be addressed. So that's, how it feels, I think. It's just that emotional regulation and that lack of joy really is a couple things that I see pretty much prominently with most kids I work with.
Pat, what about you? What are you seeing at CFI?
Well, I think those were all really good points. And and I agree with all of that. I would say in addition to that, preteens or adolescent years are such a time of, obviously it's identity development stage, right? So they move back and forth from wanting to be this mini adult to, I also want to know that my world is safe and secure, right? And just kind of keep going back and forth to that. So again, as we think about the world that we're living in today, like how is that impacting our youth? You know, as a grandmother of 4 amazing grandchildren, they are very aware what safety drills are in their schools, right? Safety drills are necessary and they're important today. We have to have them. But my first grader also knows that there are school shooting drills, right? So think about that and how that's impacting their sense of safety and security. And when there's depression and anxiety and really not knowing how to even maneuver all that. So how does it feel? It feels very out of control. It feels very helpless. It feels like I don't have the power to do what I need to do. However, I'm going to go back to what was said a little bit earlier in regards to youth advocating for themselves. And what we're seeing across the state and across our nation is that youth are looking for a platform to have their voices heard and to help them to get involved. So I loved your story, Andrew, about bringing that informal support, that CEO into the fold. And how do we as parents or community members do that more ourselves? Because kids need the formal supports and all levels of care, but they also need a whole lot of informal community supports. So.
Great.
Thank you, Pat. And I'm looking at the chat and I have to thank you all so much for sharing some of your stories. I'm glad this is a space that you can ask some of those questions and give each other advice along the way, from people saying that they have kids, daughters, sisters, or even that they're seeing some of their own issues now reflected in their children. That's really hard to deal with, but reaching out for help is the first step. So let's actually talk about what parents can do to support their kids. I'm interested in knowing how can parents learn about what kind of support to give. And also I'm going to add on how can they take care of themselves at the same time? Because we're seeing these themes around exhaustion, frustration. So how do you make yourself as effective and support yourself as a parent, and then support your kids? Dr. Khosravi, let's start with you.
Yeah, I think in terms of protective factors and going through this pandemic and a recovery through that, there's 3 factors that was really looked at in a lot of studies, and they're really simple factors. Physical activity, and I'm preaching, sleep regulation, and that social connectedness. Those were 3 really important things that showed protective factors. So if your kid was sleeping well, if they were getting some exercise and you're connecting with them, that was absolutely a massive protective factor in terms of them developing depression or anxiety or other mental health disorders. And I think I've talked about this before in some of our other Lifting the Veil events, is really making conversations about mental health routine. And if you do that, your kid will be more prone to talk to you. If you're going to only ask your kid when you think something is wrong or suspicious, they're going to shut down. So if you just kind of make it a normal check-in, kind of checking on how they're doing mental health wise and normalize that conversation, you're much more likely to tap into their thought process. Otherwise, they become defensive and guarded. So that's one tip that's really worked well. I even do it with my own kids, kind of checking in with them, every day or every other day, just kind of routine. And it really does help foster that communication and destigmatize mental health.
Mm-hmm. That's fantastic. Amber, what about you? How can parents be supporting their kids, but also what can they do to take care of themselves?
Yeah, similar to what Dr. Khosravi shared, I agree with just trying to normalize the mental health conversation. And I really think encouraging kids that it's okay to have these big feelings. It's okay to feel sad. It's okay to feel anxious. It's okay to feel angry. It's how you manage those emotions. And as parents, doing the best possible to role model that for them when you're able to. And I think, families talk about, oh, you have to have the sex talk with our kids. Well, how about we have the mental health talk? Let's have the mental health talk with our kids, and let's do that regularly. And I also think as parents, those things Dr. Khosravi talked about are key. Finding the moments in your day where you can attune to your own needs is critical. It might only be 5 minutes, it might only be 10 minutes, but being really deliberate and thoughtful and finding those moments, because as parents, this often can feel like a war that is ongoing and it's very unknown at times. And it's critical for folks to make sure they're attending to their own needs as a parent as well.
Mm-hmm. Pat, what would you add about what parents can do to support their kids and then take care of themselves?
I would say the biggest thing, again, as we continue to destigmatize mental health, is let go of that shame and that blame, because oftentimes as parents, we can internalize that and say, what part do I have in this? Is this something I did? What's wrong with me? Yes, none of us are perfect parents, but there's also a whole lot going on in our world that is impacting the mental health of our children. So I think, again, trying to reach out to the formal supports, different levels of care, and often those community supports or extended family members that can step in, or somebody in the school, coach, the teacher, whoever that is going to be able to make that connection with the child. Because the reality is sometimes others can relate to our child better than we can, because we're so emotionally reactive to what's going on. So yeah, let go.
Excellent. Dr. Wallach, what would you say in particular? What support can parents give, but then how do they take care of themselves? Because you're seeing, I know parents who have multi-year issues.
Yeah, I think that's a good frame of reference. I would echo what everyone has said. They are incredible supports that you've all listed. I would also offer to put it into a developmental context and remember that children are growing and developing. Their developmental stage plays a huge role into how they process, interpret, and react to whatever it is we put forward for them. So developmental stage is really important. I might add nutrition and decreasing social interaction via digital connections and have it be more real person. Social connection is huge for kids these days. As far as parents, I think that's a critical factor to helping our children gain strength and resiliency, is for parents to remember to take care of themselves, and their social emotional health is critical. Or it's just simply not going to be successful helping their children do some of those things. So I think that's important as well.
Mm-hmm.
Hey, Susanna, I wanted to interject. I think most conversations that I'm a part of them, it's my work. So maybe that's why they evolved to youth mental health. But the Surgeon General, of course, issued a state of emergency in December of last year. Conversations are headed this way. We've heard about suicide. And the one thing that I want to say as a parent, I'm following 7 families grieving the loss of their kids on social media every day, who they've lost to suicide, to death by suicide. And in almost every instance, they didn't know. They didn't suspect it. They didn't realize it was a problem, but somebody in that child's sphere of influence did. And so the 2 things that I would suggest and implore families is, they might not be coming to us, right? But they're going to someone. And there are times that my kids tell me something about someone else, somebody else's kids, where I have to sit there and think, gosh, should I go to the parent and share this? Or would this jeopardize my relationship with that family or the kid? And so incumbent upon me is to reach out to the families of my kids' friends and let them know, hey, if you ever hear anything about my son or my daughter, would you let me know? And open up that dialogue such that they can say the same thing. Because, and kids also, I heard just this week, kids knew about somebody who was considering suicide, but they were afraid to share it because they didn't want to jeopardize the relationship. And so kids also need to know that when they hear something, when they see something, they should be saying something. And it might not be your own child telling you something, but if we build those connections in community, I think that and open up those neighborhood sort of dialogues, we can maybe prevent a tragedy.
Yeah, and I love this chat from Wanda P, who says, reframing the question instead of saying what's wrong, saying what's happening, which I think she's suggesting takes the judgment out of it, which is very, very interesting. So Andrew, I think we probably have time for one more short question before we start moving to a wrap. If
All right, so maybe one of the four of you can step up and just take this one, but let's talk about what recovery looks like. So recovery, we've said, can mean a lot of different things to a lot of different people, but when you think about young people in recovery, what does it look like?
Oh, you're probably gonna have to call on somebody.
Somebody go.
I'll step up.
Look at that.
I think it's important to remember the journey looks so different for everybody, whether it's their developmental age, their family situation, the particular issue they're facing. What our team often describes at Child Service, sometimes as you unwrap that mental health, social, emotional challenge, the journey starts to get a little more difficult before it gets better. So I think being prepared or braced for some of those challenges as you unwrap the issue. But then we often see children starting to better identify their emotions, their needs, and then start to be able to communicate and ask for help, advocate for themselves. And then the journey starts to move forward and they can work with those therapists to regain some skills that are really helping them through those situations. That's sometimes what the journey looks like.
Really
it can be so layered, right? As you're looking at behaviors and what's happening, but yeah, what's underneath that, what happened to this child can be part of that situation. And that means that recovery can be a long-term process because life continues to happen. And kids or youth will continue to be triggered by different life events.
Well, I love the chat. I love seeing people supporting each other, the community that exists here online, but also so many resources. We've asked our panelists to share some of them, so maybe we could put those up and put them into the chat as well, such that you can click on links. So many great organizations doing so much good work. They could all use your support, I'm sure of it, and we're just grateful for each of the people for doing the work behind the scenes.
Great. We're going to chat the list of resources, but we see that others have come in through the chat. So we'll enlarge this list. And if you're an attendee, you'll get a follow-up email. So make sure that you do check your email. We'll also send you a survey that we hope that you'll take so we can get some feedback. But do check out those resources. So wonderful observations, great questions. I'm going to now ask each one of our experts to give us some parting wisdom in a few minutes, just 30 seconds or so of what you want to send our viewers off with. But while they're thinking, I do want to let you know about a couple of things. So if you felt that this event was positive, we invite you to attend the second virtual event and also tell people about it. That will be on November 15th from noon to 1, just like this. It will be virtual. And at this upcoming event in the fall, we're going to be focusing on adults in recovery. A lot of things are similar, but a lot of things are very different. Of course, I also want to invite you to subscribe to our publications. We have stunning print publications, DSM and IA. We've got free e-newsletters, DSM Weekly, DSM Wealth, and our IA statewide newsletter. Those are about wonderful things that are happening around the state. But when you do that, you also get invited to events like this, and you get our specialty publications like Lifting the Veil. If you have story ideas, we encourage you to contact Christine Riccelli, who's at the email listed. And she also just chatted, if you are a parent who would like to talk to us about your story, she would love to hear from you. If you're interested in advertising or being a sponsor, please contact Emily Schultz at the information listed here too.
So let's have some closing thoughts back to our experts. Maybe each of you could give us 30 seconds, some parting words that you'd like to leave our viewers with about getting their kids on the road to recovery. Dr. Khosravi.
I think we can look at a lot of the negatives and challenges the pandemic has brought us, but I think within that context, I think an entire world got to experience some anxiety and adjustment related mental health issues. And with that, I'm hoping that we can scrape the stigma off mental health a little bit more and people show empathy to this brave population, hoping that this allows families and children to reach out for help. And sometimes I know that's the hardest thing, is asking for help. And I'm hoping that once they hold their hand out, we'll be there to reach for that hand and pull them out on their journey to recovery.
Amber?
Treatment works. It does get better and recovery is possible.
Well said. Pat?
I would just say that recovery is possible. Believing in our youth and giving them what they need and the platforms they need, hope and encouragement, recovery is possible.
Dr. Wallig?
Live in the world of hope. We know it can be sometimes so difficult to find the road, but there are resources available.
Really appreciate it.
Andrew, do you have any parting thoughts?
Well, I love what Amber said, that treatment works and recovery is possible. I do. And, our mission at YSS is to create hope and opportunity. So here's maybe what I would encourage folks. I think the pandemic made us think differently about a lot of things. If you are considering a purpose-driven career, all of the folks on the panel have openings for jobs where you can, go to work every day and get paid to create hope and opportunity. So I really, or maybe someone that's thinking about going into a field. I would really encourage folks to, send people to human services and behavioral health and mental health, because we are desperate for help in this state and across the country.
I love that you added that. And I want to thank our sponsors again, who made this event possible. A particular thanks to our presenting sponsor, Clive Behavioral Health, to our supporting sponsors, Delta Dental, Employee and Family Resources, IMT Insurance, and Easter Seals, to our sustaining sponsors, Capital Crossroads, Mid-Iowa Health Foundation, NCMEC, and Optime Behavioral Health Services. We appreciate your support, but even more, we appreciate your commitment to the health and mental health of our communities. It's very much appreciated. Well, we are ending in time for everybody to have a 1-minute break before their next Zoom. I want to thank all of you for tuning in, for caring about mental health, and for supporting Lifting the Veil. To all of our panelists, thank you so much. To Andrew, thanks for co-moderating with me. We hope to see you all at our next program in this series on November 15th. Thank you for joining us, and thank you for caring about mental health.
Thanks,
Have a good
everyone.
day.